Good morning, Danny. How are you doing?
I'm good, thank you.
Okay, my name's Wendy. I'm working on the stroke ward today. I understand that you've been assessed by the speech and language team. They've said that your swallow isn't safe. So in order to keep feeding you and keep your nutritional status up, I'd like to put a nasogastric tube down through your nostril into your tummy so that we can continue to feed you. Is that okay?
Okay.
All right, good. So just a few instructions before I go and get my equipment. I'd like you to sit in a semi-upright position. I'm going to support your head with a pillow to make sure it doesn't tilt forward or backwards. I will have checked the oxygen and suction is working, just in case. And I'm just going to get you to see which nostril feels clearer for me. So take your finger and compress your one nostril and sniff. Do the same on the other side, sniff. Which feels clearer?
Right.
The right side, okay. And I can check there's no deviated seption, no secretions whatsoever. So I'm happy to use the right one. I have to be honest with you, Danny, it's quite an uncomfortable procedure. And if you can't tolerate it, you want me to stop, please raise your hand as a signal and I will immediately stop, okay?
Okay.
All right, I'm just going to leave you for a second while I get my equipment. Okay, so I just do my hand hygiene with my validated hand gel. According to WHO standards. Allow to dry for 30 seconds, assuming that's done, and gather my equipment. I have got my kidney bowl or receptacle that is clean, dry and intact. Assessor, is it validated?
Yes.
Okay, I have my 60ml enteral syringe. This is clean, dry and intact, expires 07/28. It's safe for me to use. I have my size 10 nasogastric tube. This expires 10/26, safe for me to use. Packaging is clean, dry and intact. I've got my pH strips. These haven't been exposed to the air and the expiry date is 05/2028, so that's safe for me to use. I have some tape which is clean and dry. Just going to don my PPE. Oh, and I have some clean warm water for insertion. Done my PPA. And my gloves. Okay, Danny, you happy for me to start now?
Yes.
All right, so I'm just going to put this bowl in your lap. You might feel the urge to vomit, so we can use this if you do. Okay. So first of all, I need to take a neck measurement. I'm going to measure my patient from the tip of their nose to the earlobe and then down to the xiphisternum, which as I can feel is here. And note the measurement is 52 centimetres. Okay, I'm going to moisten 15 to 20 centimetres of the NG tube. During insertion, if I feel any resistance at all, I'm going to try a different direction. But if the patient starts to cough, I'm going to withdraw completely. Okay, you ready, Danny? All right. As I put the tube in and you feel it hit the back of your throat, I want you to start swallowing, okay? So I'm going to go along the floor of the nasopharynx. Nice and easy. Start to swallow for me, Danny. Keep swallowing. Keep swallowing. Doing really well. Keep swallowing. Keep swallowing. And we are in at 52 centimetres. I'm just going to fix some tape. and then in a gentle loop onto the patient's cheekbone. Okay, I'm just going to test the aspirate now using a 60 ml syringe. I'm going to obtain a few mils of aspirate and immediately replace the cap. And I've got my pH strip. I'm going to put a small amount of the aspirate onto my pH tester. To ensure that it's in stomach contents, I need it to be 5.5 or less. So I can see that this is 2. So I'm very happy that this is in the stomach and that aspirate is actually gastric content. Okay, Danny, so I'm going to leave you now. Are you okay? You did really well. Just rest assured, before we start any feed, we will always obtain some aspirate and check that it's still in the right position. If under any circumstances we can't get aspirate, we may have to check it radiologically. Is that okay? All right, are you comfortable? Going to leave you with the call bell. If you need anything at all, just give me a buzz. So everything that came into contact with the patient would go into the clinical waste bin, along with my gloves and my apron. I would do my final hand hygiene.
When you were saying